Most parents, they hear the word attention deficit disorder, think, oh, immediately my kid has to be on like a Ritalin or some kind similar to Ritalin. Are there any treatments that are successful without medication?
Yes, behavioral therapies can be very helpful. One of the things you have to do is attention and training. It's just like any other skill. You basically have a child, I do this in my office all the time, where we set a timer. The child has to try to sit still, pay attention until, say, first we start with a minute or two. And we eventually, they get tokens or some kind of perhaps a little incentive that they can get. And then we try to increase it to 5, 10, 15, 45 minutes where they can basically sit, converse, and talk and stay focused.
Is it something like a behavior modification technique?
Yes, we call it behavioral approximation, where we keep getting the child to approximate what the behavior. They can't quite get it, but we get it a little more approximated, and eventually, what we call it fade, you can actually stop the program, but they've obtained the skill.
If a person was on medicine, could you combine the two therapies, though?
Well, that's usually very effective, and the studies seem to show that that's the most effective in terms of helping these kids, is the combination of medicine and behavioral therapy. Medicine alone does not really help enough for these kids. It will help somewhat with their attention and focus, but it really doesn't help with the impulsivity, and the behavioral therapy really has to supplement the medication.
So it's a little bit of partnership, a little bit of behavior mod and a little bit of medication.
And the American Medical Association does say the first line of treatment for ADHD is behavioral therapy. But that's not what gets followed. But that's actually in their regulations and guidelines.
And a key point is, someone should make this diagnosis on a one wave. It should be observation and several visits to make the proper diagnosis, because there are a couple of things that look like this and get medicine in a kid that maybe shouldn't get. Is that correct?
Yes. There's cases where that can even have some tragic results, yes.
So the first rule of anything is do your homework, take a good history, good observation, and over a few visits, maybe the proper diagnosis and therapy could be attempted initially. Is that correct?
Yes. I always advise parents who see me, but really with anyone, that whatever professional you're seeing, let the professional get to know your child a minimum of 2 to 3 months before any major decisions get made. Parents are impatient. The schools make the parents impatient. But I tell them a child cannot speak to us the way adults can. They can't really tell us. We have to infer it. We have to figure it out from a child.
And they have to understand, medicine isn't an instant improvement. Many times it does take several weeks to see if the medicine works, or the change in medicine once in a while, see that works better, or too many side effects. It's not something that's done instantly. You don't wave. You sort of like mold it slowly over a period of time.
Yeah, it's a trial and error. They say that most kids need not just trial and error on one medication. They usually, to get an effective medication for ADHD, they often need a second and third medication till they find the one that really helps without causing side effects.
And also, if you use a combined therapy, the behavior and the medication, is there a better chance the kid, as they get older, could be off medication?
I'm not aware of studies that show that per se, but it definitely it speaks to me, because the kids that come to me, many kids who come to me who've been on medication for many years, never had a behavioral therapy, and they really now are struggling, because if they're a bright enough kid and you give them medication, it might be enough to help them get through those early school years. They start hitting middle and high school or even college. And now, if they don't have some real study skills and some real coping skills, they really are at a loss.